A major breakthrough in breast cancer research as doctors say they've developed a way to predict what treatment option would be most effective for each patient. According to a professor at the Institute of Cancer Research, just a simple blood test, quote, has the potential to make treatment decisions faster, more personalized, and ultimately more effective. Here to discuss on this Medical Monday is Fox News senior medical analyst and author of the book, The Miracles Among Us, How God's Grace Plays a Role in Healing, Dr. Mark Siegel. Dr. Siegel, this is amazing news. This is great. A blood test, and then a doctor can determine how well you're going to respond to treatment.
This is the wave of the future. You know what's happening now with oncologists and breast cancer, of course, is epidemic. There's 300,000 new cases a year, 2 million in the United States, 2 million around the world. They look for targets on the cancer to go after it. Everything's targets. What are your mutations? What do your genetics show? And now we've got a liquid biopsy test that looks at that genetics, that looks at the DNA and says, well, you're estrogen receptor positive, well, you're HER2 positive, or you're triple negative. But how much of each do you have, and how did you do with the treatment we gave you? Should we alter it? Should we change the equation? This was done in London, this study, and they looked 4 weeks apart at 167 patients, and they found a dramatic ability to test this. This is what the future is going to be. It's going to be looking at response to treatment, your point, using a simple drop of blood, a single drop of blood.
So if you have 3 different ways to treat a lady's type of breast cancer, right? It will tell you which treatment's best, or it'll just tell you how she will respond to treatment 1, treatment 2, and treatment 3.
It will tell you how she will respond to treatment 1, 2, and 3, but it may say add a little bit of treatment 1 to treatment 2.
Oh, got it.
It's going to make it more of like mixture of treatments.
That's where the specialization comes in.
Yes, and that's something new where they don't just say, well, she's estrogen receptor positive. How positive? And how much of the other proteins does she have? And which of each should we give so they can mix treatments? They're going to have better outcomes because of this.
So they're saying this year more than about 322,000 people will be diagnosed. 42,000 will pass away. So if we are diagnosed with breast cancer, God forbid this year, or someone's watching that has it, what do they need to say to their doctor so they can have access to this test?
Well, this is just coming out. The first thing is, what imaging are you using? As you know, our own Nicole Saphier, a big believer in artificial intelligence. I am too. Can you diagnose this really early?
Right.
Can you get it out so it doesn't come back? And if you need these other treatments, can we follow you with that liquid biopsy blood test? That will be within the next year.
Okay. Another topic about screen times and our memories and are we paying attention? You had Matt Damon and Ben Affleck on the Joe Rogan show. And Matt Damon was talking about how Netflix and other platforms are changing the way that we make movies now, or they make movies. For instance, they'll put the action scenes at the beginning, or they'll reiterate the plot 3 or 4 times because people are on their screens while they're watching movies and they're not paying as close attention. Listen to this.
The experience of watching at home, I think, you know, you're watching in a room, the lights are on, other going on, the kids are running around, the dogs are running around, whatever it is. You know what I mean? It's just a very different level of attention that you're willing to, or that you're able to give to it. And that has a big effect. And it also ends up having an effect, or is starting to have an effect on how you make movies. We want people to stay tuned in and you know, it wouldn't be terrible if you reiterated the plot 3 or 4 times in the dialogue because people are on their phones while they're watching. You know what I mean?
So, Dr. Siegel, Gen Z spends about 6.5 hours per day on their screens. What's your reaction?
I have a few points about this. Number one, the more time you spend on your phones, the more you're going to develop potentially a kind of ADHD where you can't focus on anything. Number two, if you have ADHD where you can't focus or you have impulsivity and issues regarding hyperactivity, you may not be able to attend to movies like Matt Damon is saying. But I agree with Ben Affleck, who responded to that saying, hey, I don't agree with you, my best friend, Matt. It has to do with how good the film is. It has to do with how good the show is. He pointed to Adolescence, which was an award-winning series last year from Netflix, which drew you in. Did the 13-year-old commit the murder? People in the green room, our producers were saying, the camera follows one person. The better the film, the better the series, the more likely you won't be on your phone. So that's what I vote for. I agree with Affleck on this. What do you think?
Yeah, I agree. I mean, I watch a myriad of different shows. The ones that keep me interested are the ones that have really good plots, have really good characters. There's usually a love, a love interest in there. All right, Dr. Siegel,
I wouldn't
thank you.
repeat the plot. I don't like that.
Yeah, I agree. We're smart enough to know what it is.
Exactly.
But thank you so
Great to
much,
see you.
Dr. Siegel. His book, The Miracles Among Us, it's available now, and it's fantastic.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.